There are, in fact, multiple ways in which optometrists can utilize the translation to care process that we set up within the American Optometric Association. So for instance, a common question that an optometrist might have is, if my patient has diabetic macular edema, which is the #1 cause of vision loss in working age Americans actually, how should that patient be managed? So the guideline looked at all the evidence with respect to the degree of the diabetic macular edema and now gives the optometrist good evidence-based practice recommendations for when patients can be managed by the optometrist, when they should be referred, what kind of treatment the evidence suggests is going to result in the best visual acuity and the best patient outcome. So the guideline itself is a wonderful in-office reference tool for optometrists. It's replete with lots of useful tables, things like the effect of various medications on hemoglobin A1C, which medications cause hypoglycemia that the optometrist may have to remedy while the patient's in the office. Things like how long the patient has had diabetes and his or her relative risk for developing any degree of diabetic retinopathy, or what we call sight-threatening diabetic retinopathy. In addition to the guideline being used in the office by the optometrist as a physical guideline, it's also available online for quick reference. There's an abbreviated version of the entire clinical practice guideline that's available in just a few pages. The optometrist can have that handy to review anytime he or she is encountering patients.